Okay, so I wanted to talk today a little bit about borderline personality disorder, which is the other condition that I have. It is something which a lot of people, when I speak to them, um, they will pay attention to the bipolar bit. When I mention the borderline personality disorder, they don't seem to really treat it with the same level of severity, shall we say. I do apologise, by the way, the neighbours are doing some DIY today, so if there is any banging in the background, that's what that is. Um, so, what's the difference, for a start, between a personality disorder and, say, something like bipolar disorder? Well, it's a tough one to call, and the reason that I say that is because there are so many different theories as to what causes different psychological conditions, and it seems to be changing every few years, depending on which psychological paradigm is in fashion, so to speak, at the time. I would say that it's generally accepted that conditions such as bipolar are far more organic. That there is a problem with the biochemistry within the brain, that there is an accepted genetic factor, that it's definitely very much a physical illness. Personality disorders are pretty much as they sound. They are disorders of the personality, and yes, I think there are some genetic components to them, from what I've read myself, but I think it is probably more of a genetic predisposition, and that there are some definite non-organic causes going on. So that's kind of a bit more difficult to call, whether it's nature or nurture. But apart from the causes, one of the key features that people seem to forget is that bipolar will come in cycles. Of course it does. It's bipolar. There's highs, there are lows. There are also periods when it's not particularly evident at all. I've heard even theories, well, not theories, but cases of people who have gone years without any symptoms, and then suddenly it resurfaces. Whereas a personality disorder is constant. It is pervasive. It doesn't go anywhere. There is no reprieve. There is no period of feeling fine. It's always there. It can get better with age, as has my own personality disorder. I'm not quite sure what the prognosis is for other personality disorders. It's not something that I've looked into. But that is another big difference between the two. The other thing that I wanted to talk about is the list of symptoms for borderline personality disorder. There are certain symptoms which will manifest in slightly different ways. Plus, if you have a checklist of X number of symptoms and you require so many of those symptoms to qualify for a diagnosis, but you don't necessarily need all of them, well, you can see there how it could manifest in different ways. So, for example, one of the things that I don't have, which is usually on the checklist of borderline personality disorder, is I don't have, quote unquote, a long-standing history of intense and unstable personal relationships. I don't have those. Well, it's not something that has ever really been an issue. as far as that is, as far as the disorder is concerned. However, if you look at that in terms of employment, there's a big difference, because I'm very mistrusting of people in authority, especially people such as managers and supervisors. And it doesn't take long at all for me to become very, very paranoid, very angry, very suspicious of people in authority. I have this sort of relationship with superiors, for want of a better word, within a job situation, as from what I've gathered from reading and watching documentaries and what have you, I have the same relation with superiors as a lot of borderlines do with their other half, in that I have a tendency to idolise superiors if they're being nice, if they're being supportive, if they're being praising, but it has to be a constant thing. I need praise for everything I do in order to feel worthy in a job situation. And as soon as that changes, as soon as that alters, or the praise diminishes to a level that would be fine for anyone else, then paranoid alarm bells start going off in my mind of, well, they don't like me anymore. I must have done something wrong. I'm going to get fired. They're going to be looking for something to fire me over. And God forbid I should actually be put in a disciplinary situation. That's just something that I just cannot handle. Now, the thing is, with a lot of borderlines, they will act out. They will fly into a rage with perceived slights against them. That's not something that I tend to do. I will tend to retreat inwards a lot more and experience things such as dissociation, depersonalization, derealization, which, yes, they are symptoms of borderline, usually stress reactions. But as you can see, they are excuse me, they are different different symptoms of the same illness or same condition, but they can appear to manifest in very different ways in different people. So you will have those people who will become very rageful, will act out, will fly off the handle, and you'll have others, like myself, who tend to go inwards, which then pushes me more towards a depression. I could talk and talk and talk about this, from now until the cows come home. But what I really wanted to point out is how the borderline personality disorder can play off the bipolar disorder, and vice versa. If you have this high susceptibility to stress, as the borderline personality disorder tends to have, then of course that's like a hair trigger for the bipolar disorder, and they do definitely have a relationship, a trigger relationship, I don't think a causal relationship necessarily, but definitely a trigger relationship. So what I think I will do is I will do another video which is purely borderline, just to really get out there exactly what the symptoms are, how it affects me personally, because as a man, I'm quite rare to have the disorder. So I think that might be quite interesting for people to see what it's like from a male perspective. And then I can sort of separate that from the bipolar disorder a little bit, and hopefully you'll get a better idea of the two. But I wanted to point out that that's how they affect each other. They are separate, they are both there, they do both need recognition as a separate entity, as well as how they interact. Okay, take care guys.